what's I'm looking for? Poison. Okay. If I drink it down, I'll die. But if someone just put a drop in my coffee every morning, what will happen? Well, you won't die right away, but you will decline, have difficulties, and eventually it kills you, which is consistent with the research saying childhood trauma is associated with diabetes, heart disease, autoimmune disorders, and so forth. So we got to think about that. It's across the board. Most people will be identified as dealing with an adverse childhood experience, a trauma, if they're in quadrant 4, high toxicity, high frequency. We often overlook when it's in 3 and 2. That's the high toxicity, low frequency, or high frequency, low toxicity. But all of us level 1, and actually it could be this is the normal life when we learn to be able to accept the fact that, as the saying goes, shit happens to all of us at some point, as long as it's of low toxicity and low frequency, and we have the social emotional competencies, the supportive environments of resilience, we can do okay. So what are the common reactions to these kinds of stress environments? 5 most common we're going to see in counseling: self-stigmatization. I'm a terrible, damaged, flawed person. No one could ever love me. I'm never as good as anybody else. Loss of trust. I can't trust anyone. I must be constantly vigilant, on guard, always have my defenses up. Self-blame. I'm to blame for this. I deserve this. I was treated this way because I deserve it. There's something wrong, flawed. In fact, I was told that often and often enough. These are themes you'll hear with clients all the time. The loss of hope and optimism. That's probably the saddest one. Mental health, getting through life requires a sense of optimism, hope that things can get better. When we lose our sense of hope and optimism, life becomes pretty bleak. The idea that life will never get any better, it's hopeless. Yeah, you can see that leading to suicidal ideation and so forth. And last, we see a common outcome is what I call adaptive self-protective behaviors. Some people are going to call these disorders or symptoms. I think it's better to think that they're adaptive, sometimes very creative, self-protective behaviors. The child with the anger outbursts, the child who withdraws and becomes avoidant. Those often do with strategies important at the time to survive, fight, flight, freeze, fawn, whatever I need to do to survive. But as I get older and move towards independence and adulthood, they become very counterproductive. At the time, they were unhealthy, but they kept me alive. Might be a better way to think about them. Okay. And where does that react to biological? Well, we look at the work of McEwen and others since then. In fact, the best book on that is by Saparsky, in his book, Why Zebras Don't Get Heart Attacks. I highly recommend the book. Because zebras hang out with their friends. Our pituitary system, our HPA system, our cortisol levels are made to activate under stress and then be able to go back to normal, to reset. Some people, most of our clients have come from backgrounds where those kind of chemicals, the hypothalamic, pituitary adrenal system, the cortisol levels were constantly activated, hypervigilant. I can't help but wonder how many kids are diagnosed with ADD, ADHD, which are really just because their brain is learning to constantly be activated to protect themselves, not to focus and be calm. So I won't get into that. So from a resilience perspective, here's how we see the development of psychosocial disorders. We start in 1, adverse social ecosystems, the lack of those 4 components. A strong ecosystem, learning the social emotional competencies, a chance to feel successful and competent in life as a contributor. From those, we develop a cognitive schema, a way of viewing ourselves and lives, which gets into as I said, the 5 different common characteristics. I deserve this. There's something wrong with me. As a result of that kind of thinking, we go to the biological effect, which is now my HPA system has been active. I've what McEwen called allostatic overload, inhibited executive functioning, as though that making bad decisions and so forth, because to really calmly think through solutions and handle problems requires cognitive calmness, emotional calmness in order to do that. Result of the biological maladaptation to stress, we end up with maladaptive behaviors, externalized or internalized, and that covers most all the disorders you're going to see walking in your office as a counselor. Result of that, maladaptive patterns, people react to us based on that behavior. I call this my wife and I call it the infinity loop. Okay, I respond in one way, it gets people to respond back to me. The problem that reinforces my first thought, which reinforces my behavior, and it goes on forever. Excuse me again. So, okay. So, and I'm giving you a sort of a framework here to think about resilience. Inviting you, don't have time to get into all the aspects of it, but it's a framework and say, okay, now freeing up my thinking, I can start to develop some creative, different approaches. And one model I give to you is the resilience coping with adversity ABC model, A.C.E.S model, we should say. And here's how this model works. It says the A factor in this equation, A, B, C equals X. A is the totality and severity of adversity, trauma, and stress factors in your life. That as a therapist, a counselor, I have no control over. Okay, some people have been dealing with terrible life situations. I can't begin to tell you how many times I've looked at a client and said, only one thing I don't understand, how are you still standing? And what brings you to counseling? How do you still have the hope, the optimism? You're a better man than I, or a better woman, because it's overwhelming just hearing their stories, let alone thinking of what it was like to live those stories. I continue to live those stories. So, but in terms of how that reflects in terms of distress, severity of the symptoms and so forth, is compounded. And this is one thing that we have not talked about enough in resilience and the adverse childhood experiences effects. What was the role played? Some people deal with the same type of situations and some will survive. Others don't. Others go down the tubes here very quickly and end up in all sorts of difficulties, social, legal, health, whatever it can be. That's because there's 2 other factors. The severity, the A factor, is also then moderated by the B factor, the availability of supportive social ecosystems, and how well developed your social emotional competencies have been. That's the protective factor. That's the vaccine that can offset a lot of the A factors. And C is the mindset perceptions, the meaning one gives to these events. Okay, it's all my fault, or I can overcome this. That's a very different cognitive framework. That comes from the development of resilience, that growth mindset. It's the interaction of those 3 variables that results in the X factor, the degree of severity of distress, symptoms, so forth in life versus your resilience, ability to bounce back up, get back on track, and continue to move forward. So as a mental health professional, I can't do much about A, but I want to make sure I am working in the community as much as possible to develop ever more supportive social ecosystems and develop social emotional competencies of youth. And same way with my clients. What can I do to develop that in my clients, develop their health, their resilience, not just to treat the symptoms. And C, I want to talk from a growth mindset position. I want to teach people in the workplace, in the school place, and parents how to talk to your children from a growth mindset position, one of encouragement, and focus on you can do it versus you'll never be able to do it, you can't, you are not capable, whatever. So I'm going to stop there. There's obviously a whole lot more we can go on to. But I'm going to stop right there. And Lucretia, where do we want to go from here?
Well, first, I just want to thank you for the content, some really, really amazing information. I love the way that you have organized this so that it's easier to see how, where that breakdown happens from experiencing these lifetime traumas and events to developing those maladaptive behaviors and those negative cognitions that lead a lot of the clients that we see to our chairs. Being able to understand their perspective and empathize with their position is really useful. And I definitely know there are a lot of us familiar with ACEs and looking at the being able to, I like the diagram that you presented, that kind of gives you a different perspective of looking at it. So it makes it a little bit more tangible, in my opinion, when you're thinking about, there's the low end of things where there are some people who maybe have just had one experience that they consider to be traumatic. But it's about whether or not they have that support system, those pro-social behaviors and emotional responses built in, or the things that they need in their life to be able to develop a healthy outlook and progress positively, as opposed to on the other end of that spectrum where we have those people who are seeing this is their everyday life. Their everyday life is waking up and going to bed to, gunshots and violence and different things going on in the environment, depending on who it is. And so those are the ones where that resilience piece is going to be critical to changing their outlook on life, their interactions, their ability to interact with other people. So really, really love the work. I really love this topic. And I really thank you so much for taking the time out of your day to join us and present this information, because it is really critical and useful for our field. Any last thoughts or any last quotes? You had some really awesome quotes that you included in there. Anything that you'd like to close out on today?
Well, that's not fair. Now I have to admit I have no awesome quotes whatsoever. I would have written one down.
You found so many.
I will give you one. Okay. I will give you one awesome quote that you remind me of, and that's by Mark Twain.
Okay.
Who said, "The problem is never that we know too little. The problem is that we know so much that just ain't so." And in our field of counseling, there's a lot out there that just ain't so, but it dominates the narrative.
Absolutely.
Of counseling and therapy. And with switching to a resilience perspective, I'm inviting people to say, and that's what I'm trying to develop, some frameworks to say, think from this perspective. If my goal here was not to reduce your depression, reduce your anxiety, but rather to increase your sense of resilience, the social emotional competence, increase your mental health, and then we'll check back with the symptoms.
Yeah.
If they're still there, that's a whole different perspective. And stop labeling people, stop using a fixed mindset narrative to talk with clients and to people in the community about mental health when that's counterproductive for their own mental health.
Absolutely.
We as professionals sometimes speak in a narrative that adds to the mental health problems of our clients rather than tries to relieve them. I've mentioned words like DSM, ICD. Yes, you suffer. And I hear that a lot with adolescents these days, especially. Oh, my anxiety prevents me from doing it. You don't have anxiety and depression. You generate that because of the way you think and the things you've experienced.
Yeah.
And you can learn to defeat them and be the winner. I don't have to let this define me. So change the dialogue and even in our own profession is where we need to start. And then we can go out in the world and do the same.
Absolutely. And it's thinking about, it's not what's wrong with you, but what happened to you.
Yes.
What happened to you to produce, what you're experiencing. So I love that. Thank you. Thank you so much.
That goes back to Gabor Mate's work and addiction. So it's not why the drugs, it's why the pain that has you use the drugs.
Exactly.
And that comes across now, not just in that field, but every area. What's going on?
Right.
And be able to examine ourselves. One of our handicaps as human beings is our eyes are fixed ahead, so we can only see the world out there, and they're not good at looking at the world in here. What is my part to this? Person who is my doctoral mentor, I always loved his phrase, is that he said, for every problem, nobody is to blame, but everybody's responsible. Some have bigger parts, some have little parts, but what's my part in maintaining this cycle, maintaining this pattern? And we need to start as mental health professionals saying the same thing. What part do I play in the assumptions I've made? And then let's go on to everybody else taking their part and say, let's all make some changes.
Yes, I love that. Yes, I have the most cliche quote of ever, but I live my life by it, is Gandhi, we must be the change that we wish to see. And it starts with us. We are the ones that lead this. People are turning to us in what are some of the darkest times we've seen in over a decade. And it's critical that we in these positions know how to handle ourselves, know how to present ourselves, and know how to use the language that is critical to connecting and really seeing people, as opposed to being more worried about the labeling. And like you said, oh, well, I have anxiety or I have PTSD. And it's like, okay, yeah, well, that's your medical diagnosis, but that doesn't define you as a person. Having that person-centered approach to look at a being, you're a person before anything else. Us as clinicians being able to exude that is something that we need more of.
We need a lot more of that. We need a lot more of examination of the assumptions, as Mark Twain said. The problem is we know so many things that just ain't so. And looking at our own field and the assumptions we made, this is what mental health is about, this is what treatment's about, and this is how you, wait a second, do you have 100% success rate? No. Okay. Then we need to go further. A growth mindset within our own profession. Where are we not functioning well? And there's one of the things that a man named Jim Collins, who wrote a book and did research on effective corporations and businesses, and one of the observations he makes is that one of the signs of a poorly functioning system, organization, is when someone points out a flaw, a problem, a limitation, they do one of three things, or all three. First of all, they try to shoot the messenger. Okay. You don't know what you're talking about. Secondly, they circle the wagons, like the old cowboy movies, to defend the status quo. And the third thing they do is start fudging the data. And right now, I see all three of those go on in the mental health field. Okay. When you get criticized, you don't know what to talk about. They criticize people. We circle the wagon to defend the status quo, defend the profession and the assumptions we make on our particular counseling model or whatever. And we fudge the data. You look at the DSM. We talk about people say, I have anxiety, but studies have shown that 40 to 50% of people who show up for their first counseling session have already decided on what their diagnosis is. They present themselves, I have this, they present the diagnosis. And about 40% will already be able to say, I'm wondering if this medication I saw on TV, and this is a unique problem to the United States, maybe a little bit to New Zealand. Fortunately, the rest of the world has stayed intelligent enough not to allow pharmaceutical companies to advertise on TV, as we didn't until 1992, when that law was changed. That created a big problem in changing the mindsets of the general population, and probably has a big effect on the lack of resilience and the increase in mental health problems. Because we've had a lot of unhealthy narratives bombarding us all the time. And what are we doing as mental health professionals to counter that? And are we? There's a lot of work to be done in our field, right here at home and elsewhere. And we got to see the strengths and the elsewheres. What are the strengths of coming from a difficult life situation, from a developing country, a third world country? What are the strengths you can also get out of growing up in adverse conditions? When you have the supportive system around you that says, now at least I know there's options. I can be this way or that way. And that's what, again, the resilience researchers advocate over and over again. As long people who deal with adverse life situations that don't end up with problems, it's because there was at least one supportive environment, individual, someone there that said, I believe in you.
Absolutely.
As little as going back to teachers, when you ask people, who's the best teacher you ever had? And then you ask them, tell me about that teacher. What do you most remember about them? They never mentioned curriculum. They use the curriculum and so forth. Whoops. What they do mention is, I had the teacher who believed in me even when I didn't believe in me. The teacher who took time to get to know me as a person and not as a student, had a sense of humor, made it interesting and fun to be in that classroom. Social emotional competencies. That was a resilient teacher, a mentally healthy teacher who knew this. There's more than teaching than curriculum.
Absolutely.
You're teaching your kids something way beyond curriculum. You're teaching them about life and how to handle life and developing those skills for their life. As long as kids have some of those environments, they can handle the other things.
Yeah.
Not easily, but they can handle them. It's when you have run into adversity and you don't have those supportive environments, you don't have those skills, you don't have that growth mindset, you're extremely vulnerable. That's what we've got to be focusing our work on from a resilience perspective anyway.
Absolutely. You're absolutely right. Once again, thank you. Thank you so much for your time and love.
Thank you for having me and keeping me off the streets for one more afternoon. Something semi-productive.
Awesome. Well, I hope you enjoy the rest of your day. And I'll be in touch. I'm sure Frank will too. But thank you again.